This office conducted 5 separate investigations of adult medical daycare facilities in Lakewood, Elizabeth, Belleville, Edison, and Northfield. We found problems at all 5 of those facilities, particularly in terms of the payments the facilities had sought and received from the Medicaid program. It's not often that we look at this many service providers in one industry and find these kinds of problems at all. Each of these 5 facilities, we had individualized reasons for commencing these investigations. We've received tips from the Department of Health in terms of information that they've come across in the work that they do. We also received information in some cases from the Department of Human Services. And in some of these cases, we received independent tips from folks like former employees of these facilities. In numerous instances, our investigators found adult medical daycare facilities received state and federal Medicaid dollars for services they could not possibly have provided because they had billed the state for patients who were not even in attendance on the days in question. At one facility, we found the state had been billed daily for more than a month for services provided to an individual who was actually away on vacation that entire time. Another facility similarly billed for services supposedly rendered to an individual on 30 different days on which he was absent from the facility. And in one case, the state actually paid more than $10,000 for services provided to an individual who never attended the facility at all, even though some preliminary paperwork had been completed concerning that person. At yet another facility, documentation indicated that various individuals were not present at the facility on 133 of the 228 dates of service that we reviewed. That's more than 50% of the days that we checked. The facility did not have any indication that the person was actually there in the form of sign-in sheets and times reflecting their arrival and departure that are required by state regulatory law. And then there was the facility we asked for 28 files for representing patients that the state had made payments for. The facility couldn't even provide us with 6 of the 28 files. Not even one piece of paper for those 6 of the 28. Our investigations also raised questions about the level of care provided by these facilities. A review of patient records at one facility, for example, uncovered a consistent failure to perform or document essential clinical and medical tasks, such as monitoring blood sugar and blood pressure for patients who were attending the facility so that they could receive those very services. Another facility routinely documented that its staff administered insulin to a patient at times when she had not yet signed into the facility for the day. Our office has either obtained or is in the process of seeking financial recoveries and penalties from each of the facilities we investigated. But going forward as a state, we certainly must do more to make sure that these Medicaid funds are being safeguarded. Our office